madam.
So directly simultaneously it's going to the YouTube also, na?
Yes, sir. Yes, sir.
Simultaneously at the same time.
Yes, yes, sir. Yes, sir.
Yes, sir.
Okay. How it will be connecting to the YouTube?
Sir, live streaming, sir, it is.
Live screening
Sir. Sir.
on the system itself only, yeah? Or
Sir, system itself only, sir.
live screening,
Sir.
where it is in the share screen,
It comes
or
in Zoom only, sir. It comes in Zoom only as option, sir.
Option of Zoom, sir.
Okay.
Yes, sir.
It is in room itself only.
Zoom itself, sir.
Okay.
Only 100 students can participate in Zoom, sir. Others can watch through YouTube.
Yeah. Yeah, that in Zoom only limited 100 students. Yeah. Actually, the founder is Dr. P.K. Warrior, no? This.
Sorry, sir.
But usually founder is P.K. Warrior.
PS Warrior, sir. Sir. Now, PK Warrior, sir, was the managing trustee.
Now PK Warrior is managing.
PK Warrior, sir.
Yeah. That earlier is PS Warrior.
Earlier PS Warrior.
Yeah. How many students in your college right now?
3 per batch, sir.
No, total students for first year?
63.
63.
Yes, sir. Yes, sir.
Okay.
Engine 2. Sharing a balance. Front screen. Good afternoon and warm welcome to Prayog Rachana 2021, a webinar series organized by Rachana Sharira Department of Vpsv Ayurveda College, Kottakkal. With profound grief and sorrow, we regret to inform the sad demise of one of our governing body member of KASRS and managing trustee of Ayurveda Shala Kottakkal, Padma Bhushan Dr. P.K. Warrior sir, on last Saturday afternoon. Let us pray for the departed soul with a silent prayer of few seconds. Thank you all. For the welcome speech, I request Dr. Bindu KK ma'am. Professor and HOD, Department of Rachana Sharira, Vpsv Ayurveda College, Kottakkal. Over to you, ma'am.
Good afternoon, all. As you all know, Ayurveda has had a great loss 2 days back with the demise of Padma Bhushan Dr. P.K. Vaidya sir. He worked towards popularizing Ayurveda by significantly contributing to research, upgradations, and expansion of traditional practices. He helped the modern world understand the scientific basis of Ayurveda and brought global acceptance to Ayurveda. He was also a great humanitarian and a humble and caring physician. He will always be remembered for his contributions to Ayurveda. We pay homage to his departed soul. Coming to today's session, firstly, I would like to bring to your notice that upon suggestions and feedback from the students, a slight change of topic has been made. The topic for today's session has been changed to clinical applications of Axilla, and it will be taken by Dr. Giridhar M. Kandi. He is a retired professor and HOD of Department of Rachana Sharira. He is an eminent academician and a good clinician. It is my pleasure to welcome Giridhar M. Kandi sir to this session. Welcome you, sir.
Thank you, madam.
I also welcome all the faculties and students who are watching this program. Once again, welcome all and thank you.
Thank you, ma'am. About Dr. G.M. Kandi sir. Sir has got an experience of 40 years in the field of teaching and is recognized as postgraduate teacher and guide, PhD examiner of RGHS Bangalore and various other universities. Sir is the chairman of All India Sharira Research Institute, Karnataka, which is headed in SDM College, Hassan. Sir has presented around 33 papers in various national and international conferences and has presented around 26 articles in various reputed journals. I once again welcome Dr. G.M. Kandi sir for today's section. Over to you, sir.
Thank you.
Welcome, sir.
Thank you. Okay, shall we start?
Yes, sir.
Okay.
Sir, slides
Okay,
are
I will
visible now?
start. Yeah.
Yes, sir. Sir, you can proceed,
Yeah.
sir.
So I will continue.
Yes, sir. Yes, sir.
So good afternoon to everyone. I very much thankful to the management of Kottakkal Ayurvedic College and Kottakkal institutions. First of all, I thankful to management and principal and faculty members and the members of the Rachana Sharira department. So giving me an opportunity to share my knowledge. It is just a share my knowledge, which will be in related to the part of the sharing the anatomy knowledge. So I would like to once again, it is my pleasure to share my knowledge with all of you, the number of faculty members, the number of experts, the number of the masters and would-be masters are joined here. So once again, I welcome and heartily thankful to the organizers. So let us come to the part of the anatomy. So here today, I would like to present you the regional part of the axilla. So as you already know, the body is divided into 6 regions. Suppose we are going to study of the according to that region, usually it is called as regional anatomy. So what is that regions? The body is divided into 6 regions. That is 2 upper limbs, 2 lower limbs, and head and neck and trunk portion. So the whole human body is divided into main 6 regions. Again, these 6 regions are going to a subdivisions. They are called as sub-regional parts. So we are going to the some regional part of the human body. Then it will be may considered as a regional anatomy. So usually the common method of study, the common study of anatomy is always to be a preferable regional aspect, whether you have to go for theoretical part of you or even in practical part of you. And somebody's are likes the systematic anatomy, that is as according to the system wise. So that is also in one part of the portion of understanding, but the more identical method is usually we are going to make a preferable regional anatomy. So today I am going to presenting with all of you the regional anatomy, the particularly the anatomy of the axilla. So the what is the axilla region? So now we'll coming to the portion of the particular region. So what is that region? The region is the nothing but the part of the portion of the particular area. So here the axilla region, generally we are saying that, or you make it an identification just below the shoulder joint. Just below the shoulder joint, the armpit region is axilla, as in generally. The just below the shoulder joint, the armpit region is usually called as the region of axilla. So as in related to the anatomical structures, how could you make it of this region? So it is a region between the pectoral muscles, mainly the pectoral major and pectoral minor, that is an anterior aspect. The scapula, that is on the bony portion, that is on the posterior aspect. Then on the lateral aspect, the arm, that is mainly the humerus bone, or in generally you can take arm. And in the medial aspect, the thoracic wall. So this is the just a brief boundary. Anteriorly, there are the 2 pectoral muscles as a brief. Posteriorly, the bone scapula. The lateral aspect, there is an arm region of the upper limb. And in the medial aspect, the thoracic wall. So almost this is a pyramidal shape, and particularly it's a depression part. It is a depression. So that is why it is called as pit, arm pit. It's a depression that bounded by the walls and usually lies between the upper part of the thorax on the medial side and upper part of the humerus on the lateral side. That is the exact location of the axilla. What is that? Just the upper limb is connected to the trunk. So in the medial side, there is a part of the thorax, and the lateral part, the portion of the humerus bone, there is the arm region, that is on the lateral aspect. So in between that, there is a depression. That depression is particularly armpit. This armpit is nothing but the axilla region, anterior wall bounded anteriorly with the pectoralis muscles and posteriorly the bony portions along with the muscles, that is scapula and some of muscles. So this is the axilla region. Make it very confirmation, or in general you can be remember always just below the shoulder, the depression area is called as axilla region. Next please. So it is a transitional region through which the vessels and nerves are passes from the root of the neck into the upper limb. So it is the region of the just below the shoulder joint. So we can say it is an armpit and it has the communication. So be remember, it is a gateway. How? From the neck to the axilla region. It is a passage. Yes, next. So that communications, that passage, which will be make a very clear concept, that is cervico axillary canal, that is gateway to the axilla. That means the structures from the neck region, from the cervical region, they passes through this part of the axilla and reaches to the portions of upper limb. It may be a vessels, or it may be a nerve fibers, or it may be a lymph vessels, whatever is the most of that of the upper limb organ structures which will be passes from the neck to the axilla region. Then you will coming to the boundary of this axilla. What is that boundary? So the boundary is usually it has the apex and base and floor and the anterior wall, posterior wall, and also medial and lateral walls. We can say simple, it has the apex, base, and floor, and having four walls, anterior, posterior, medial, and lateral walls. So first come to the one by one, the apex. The apex of the axilla is bounded by the clavicle anteriorly and the upper border of the scapula posteriorly. The apex part is upwards portion that is bounded by the clavicle bone anteriorly, the upper border of the scapula posteriorly, and the first rib medially, and usually it is pointing upwards and medially towards the coracoid process. And again, it is most important passage that communication with the neck through a cervico-axillary canal. This cervico-axillary canal, we may call it the gate of the axilla because the structures enters through this canal, that is usually called as cervico-axillary canal. This is a part of axilla. Yes, next please. Coming to the base of the skull. So usually the base of the skull is usually formed by the skin and fascia of the armpit. And usually this is directed downwards and laterally. The base of the skull is downwards and passes laterally. Then coming to the anterior wall, the anterior wall is particularly the two muscles most important. One is pectoralis major and another one is pectoralis minor. The first external pectoralis major, next to that deep pectoralis minor. And another one muscle that is subclavius, just below the clavicle bone, that is the small muscle which will be just below the clavicle bone. It is subclavius muscle along with clavipectoral fascia. So what is that fascia? It is nothing but connective tissue which will be connect the clavicle and pectoral region, that is mainly related to the pectoral muscles. So that is called as pectoral fascia. So we can be remember the two muscles, pectoralis major and pectoralis minor, and small muscle that is subclavius muscle and the clavipectoral fascia. Then again we'll come to the posterior wall. The posterior wall is particularly formed by the subscapularis muscle. It is mainly related to the anterior surface of the scapula. So then again, the other muscles, the teres major and latissimus dorsi muscles, and also there is a posterior axillary fold that mainly forms by the two muscles, that is teres major and latissimus dorsi muscles. That is the posterior wall. So the posterior wall is particularly by the subscapular muscles. That's a major part that mainly related to the anterior surface of the scapula, then teres major and latissimus dorsi muscle, and also there is a fold of axillary fold that is in the posterior aspect. Almost it forms as a posterior wall. Next please. Next slide. So usually the another important you have to be remember, usually the subscapularis takes a part, major part. The major muscle is subscapularis, which is mainly forms as a posterior wall. Then again, the teres major that lies below and lateral to the subscapularis. The teres major is lies below and lateral to subscapularis, but the latissimus dorsi muscle winds the lower border of teres major and comes to lie in front of it. So be remember again, the anterior and posterior walls, the lower borders, is formed by the muscles that is usually called as anterior and posterior axillary folds. So if you want to identification of this anterior and posterior axillary wall, so folds, so you have to be remember your arm should be in abduction portion. If you make a arm abduction, then definitely you will make a clear identification of the anterior and posterior axillary fold. Along with the wall also will be make a very clear cut identification, that is in a surface marking and usually by practically observations as in generally in the human body. Next please. Then coming to the medial wall is usually a larger and border, that is will be a longer and convex in nature. So particularly this wall is covered by one of the important muscle, that is serratus anterior muscle along with its nerves. So usually this muscle and nerves overlies the medial wall. So usually the upper portion of the thoracic wall, that is forms as a medial wall, and as well as just if you go to the deeper, there are the ribs and also including of the sub intercostal space that will be on the medial aspect. Then coming to the lateral wall, so usually the lateral wall is narrower and smaller. We can take it as the intertubercular sulcus, or it is also called as bicipital groove. So what is that intertubercular sulcus? That is nothing but the sulcus in between the two tubercles of the humerus. One is the greater tubercle and another one is lesser tubercle. So in between the greater tubercle and the lesser tubercle, there is a groove sulcus. So usually that is bicipital groove, because in this groove there is a bicipital tendon, the biceps muscles. The long tendon is particularly lies in this groove, so it is called as bicipital groove. So along with the tendon of the biceps and also the coracobrachialis muscles forms the lateral wall. The coracobrachialis is muscles which originates from the coracoid process, that is also will be lies on the lateral aspect. So these will be forms as a lateral wall. Then coming to the floor is mainly in related to the skin and the deep fascia, that is mainly in related to the skin and deep fascia, which will be attached to the lower borders of anterior and posterior walls. So usually it is just a fascia and covered by the skin, the same continuations which will be lower border of the anterior and as well as posterior walls, and as well as folds of anterior and posterior axillary folds. Usually there will be a large amount of the fatty tissue which will be present in the floor region, which will be lined by or it will be covered by particularly fatty tissue. Yes, next please. Yes, then we'll come to the important content of the axillas. So what is the contents? So important you have to be remember the vessels. What are that vessels? Mainly the axillary artery and axillary vein, the axillary artery and its major branches, and axillary vein and its tributaries, which are mainly present in this region. So they are called as axillary vessels. That is nothing but axillary artery and its branches, axillary vein and its tributaries. And apart from these vessels, there is an important nerve network, the nerves network, especially the spinal nerves. So that is called as brachial plexus. The brachial plexus, the network of the spinal nerves with its cords and branches, that is usually the network of the spinal nerves, that is in one word we may call it as a brachial plexus. along with its cords and branches of the plexus, which is mainly present in the axilla region. Along with that, there is an axillary sheath. That sheath is mainly covers the vessels and also portions of three muscles. There are the three small muscles which are also present in this region of axilla. Then considerable amount of fat and as well as connective tissue. Yes, madam. Any doubts? So considerable amount of fatty
Yes, sir.
tissue and as well as connective tissue which will be present in the axilla region along with lymph nodes, lymph vessels, and another important you have to be remember that is intercostobrachial nerve, which is the lateral cutaneous branch of second intercostal nerve, which will be crosses the floor region. This is also one of the important that is particularly intercostobrachial nerve, which is mainly passes or it crosses the floor region. It's a branch of lateral cutaneous nerve that is to be going to the portions. Yes, next please. Then coming to the details one by one. Not I'm going to the much more details. Just I will go to the brief portions of that of the content of the axilla. So here the content of the axilla is one of the important is the axillary artery. So what is this axillary artery? So it is a main artery which supplies the oxygenated blood to the upper limbs. So be remember the axillary artery. It is the main artery. It will be oxygenated blood is supplied to the upper limb that is in the axilla region. What it is? It is the continuation of subclavian artery. The continuation of subclavian artery that is extends from the outer border of the first rib up to the lower border of teres major muscle. After that, it is continuation as brachial artery in the arm region. So the same continuation from that subclavian, then that is in the axillary region is axillary artery that is particularly from the outer border of the first rib to lower border of teres major muscle. Then it becomes as a brachial artery in the arm region, enters the cubital fossa. There it divides radial and ulnar artery in the forearm region. That is the continuation. So here usually be remember important of this artery in the axilla region because this artery is divided into three parts by the pectoralis minor muscle. The pectoralis minor muscle is crosses this artery. It makes a three parts of the artery. That is one first part, then second part, and third part. So how to make it divides of these three parts? Simple. Medial to the muscle is first part. For example, if you take from the outer border of the first rib up to the medial border of the muscle is a first part. Then second part is posterior to the muscle, that is from medial border to the lateral border in the posterior aspect is the second part, and from the lateral border to the up to the lower border of the teres major you can take it as it is third part. So usually that is the three parts of the axillary artery, first, second, third, in related to the pectoralis minor muscle. So almost arteries beginning lies close to the medial wall. First at the beginning level, it is almost medial to the medial wall, close related. Then it runs towards the lateral wall of the axilla. That means it crosses from medial to the lateral side. Yes, next please. So then we'll come to the important branches. So simple formula, you have to be remember 1, 2, 3. How many parts? There are three parts. And how many branches? Part first, 1, part second, 2 branches, part third, 3 branches. So just you have to be remember. So usually the portion is first part gives 1 branch, second part gives 2 branch, and third part gives 3 branches. So 1, 2, 3 parts. The branches you will be remember 1, 2, 3. That is simple formula for your remember and to make it an identification. So what is the first branch from the first part of the artery? That is superior thoracic artery. So this superior thoracic artery arises from the first part of the axillary artery. Then from the second part, the 2 arteries, one is thoracoacromial artery and another one is lateral thoracic artery. These 2 are from the second part of the axillary artery. Then from the third part of the axillary artery, so here the subscapular, that is the one, then anterior humeral circumflex and posterior humeral circumflex arteries. So these 3 arteries are usually from the third part of the axillary artery. So be remember from the first part 1, that is superior thoracic, from the second part 2, thoracoacromial and lateral thoracic, and from the third part anterior humeral, posterior humeral circumflex arteries along with subscapular artery. That is the branches of axillary artery. Yes. Next, please. Yes. Just I will come the brief explanations of these arteries. I am not going to the details. So usually the first branch from the first part, that is superior thoracic artery. It is a small branch. Usually it passes between the 2 pectoralis muscles, that is major and minor muscles, and it is anastomosis with the branches of intercostal arteries. Then come to the second branch and second part. So thoracoacromial artery. So this thoracoacromial artery, it arises under cover of the pectoralis minor muscle and winds the upper border and pierces the clavipectoral fascia and usually divides into 4 branches as in related to the clavicular, acromial, pectoral and deltoid arteries. So you have to be remember this word itself, it be indicates that branches is supplies to that part of the region. Suppose if you take a clavicular to the clavicular region, acromial artery, acromial region, pectoral, pectoral muscles, deltoid, deltoidal muscles, like that. The word itself will be indicates the distribution of that particular branches. These are the 4 branches from the thoracoacromial artery. Then coming to the lateral thoracic artery. So usually it is arises under the cover of pectoralis minor muscles and it is mainly supplies to the serratus anterior muscle. That is the mainly in related to the anterior serratus muscles, which will be portions of the things. So this is about the portion of the lateral thoracic artery. Next, please. Then coming to the another important, the subscapular artery. See, it is the largest branch arises from the third part at the lower border of subscapularis muscle. It is the largest branch among all the other branches. So it is from third part at the lower border of subscapular muscles. It gives the branches as a circumflex scapular arteries, then runs towards the inferior angle of the scapula for its anastomosis with lateral thoracic, intercostal, and deep branch of the transverse cervical arteries. Then another important of this subscapular artery you have to be remembered, that is the terminal part of artery accompanied by the nerve. That nerve is to latissimus dorsi muscle. So this nerve and this artery pierces at the one point, at the same one point. This artery and nerve both are runs side by side and entering into the one portion into the particular of the muscles of that region. So then it is called as neurovascular hilum. It is one of the best example in related to the nerve and artery which will be passes through the same regions. The same region means in the same point they are piercing. That is the most important in related to the region. So that is usually called as neurovascular hilum. The neurovascular hilum means be always remember everywhere if you get the hilum neurovascular, that is nothing but side by side there is a nerve and as well as vessels. Both are entry into one way, one door, the one point, not in a different point, in one point. You can say at the same door, at the same single door, both are entry. So that is usually called as hilum. So here it is one of the important point. Be remember in clinical aspect, that is the neurovascular hilum in the region of this particular artery. Yes, please next. So then again, another two important arteries, that is anterior and posterior circumflex humeral artery. Why? So this anterior circumflex humeral artery, that is arises from the third part near lower border of subscapularis muscle. So this is runs in front of the surgical neck of the humerus and gives the ascending and descending branches in the bicipital groove, and it is anastomosis with the posterior circumflex humeral artery. Just at the region of almost you be remember the surgical neck of the humerus. The surgical neck of the humerus, which will be surrounding or circumstance by an of these two arteries. What are that? Anterior circumflex humeral and posterior circumflex humeral. Both are circles the surgical neck of the humerus. So they are called as circumflex humeral artery. So this anterior is arises from the lower border of the subscapularis muscles nearer to that. Then it runs surgical neck front aspect and gives the two branches ascending and descending branches at in the bicipital groove. Then at the same time it anastomosis with the posterior circumflex humeral artery. Then another one important is be remember. So this artery runs behind the surgical neck of the humerus passing through quadrangular space. That is another important. So this artery, that will be the which one? Anterior circumflex humeral. It also runs behind the surgical neck and will be passing through the quadrangular space along with the axillary nerve, and there it will be anastomosis with the anterior circumflex humeral artery branches that portions. So here you have to be remember anterior and posterior circumflex humeral artery. Yes, next please. 1 second, go previous please. Go one, yeah. So here there is a small corrections. The sixth is also it becomes as an anterior. We make it correction. It is not anterior. It is posterior circumflex humeral artery. The sixth one. Fifth one is anterior circumflex. The sixth one is posterior circumflex humeral artery. There is a small mistakes. So just you have to make it correction. That is posterior circumflex humeral artery, not anterior. But I told in while explanation that is both are, that is anterior and posterior, but small mistakes. Yeah, that will make a posterior. Yes, right, correct. So this posterior, the anterior and posterior are the two important arteries mainly in related to the surgical neck of the humerus. That is the point. Be concentrate. So this posterior circumflex is runs in through the quadrangular space and the posterior aspect, and it will be along with the axillary nerve. There we may have an anastomosis of both. Which one? Anterior circumflex and as well as posterior circumflex humeral arteries. So that is the point. Yes, next please. Yes, you can see here there is a clear picture of the axillary artery. You can see what I'm showing is this is the rib, first rib. So this is subclavian artery continuation from this outer border of the first rib up to the lower border of the teres major is becomes axillary artery. See here, this is the pectoralis minor muscle. That insertion is in the coracoid process. Origin is third, fourth, fifth costal cartilages. So this muscle is very clinical point of view have to be remembered because it will be crosses. That means the vessel is lies back to the muscle. So the same thing is what I told. This artery is divided first part, second part, third part. The first part is just medial to the muscle from the outer border of the first rib up to the medial border. First, posterior to this muscle is second one. Then from the lower border, or you can take it as a lateral border or a lower border, whatever is. Then from that up to the lower border of the teres major is becomes as a third part. Then you can see in the first part, first artery that is superior thoracic. In the second part, the two arteries that is thoracoacromial, and the another one is clavicular, that is superior clavicular branches, and also that is lateral thoracic. Main two be remember, one is that is thoracoacromial and another one is lateral thoracic. The two, this gives the branches. And in the third part, three important arteries. One is subscapular, largest artery, then two anterior and posterior circumflex, which will be makes the circumstance of the surgical neck of the humerus. These are the branches. You make it in a very clear picture, the part of the axillary artery. If you remember this anatomy, so definitely will be understanding the clinical point of view. What will be the happens in clinical related. Yes, next please. Next slide. Then coming to the vein. So usually the vein is drains the venous blood from the lower, so that is the part of that upper limb portions, all the lowest portions of the upper limb, the totally whole. So usually it will be reverse. What is that reverse? That is from the lower border of the teres major muscle up to the outer border of the first rib. That is the continuation of basalic vein. So that continuation of the basalic vein is continued up to the outer border of the first rib. After that, it continued as a subclavian vein. So be remember, the limbs, upper limb has the two important superficial veins. Two other superficial veins are also there, but main we are going to make it, one is basalic vein and another one is cephalic vein. In between these two, there is also a median vein of the forearm, and there is communication or a contact or that will be joints in between the cephalic and basalic is median cubital vein. Like that, the superficial veins. The most of the venous blood of the limbs which will be carried by these two veins, one is cephalic and another one is basalic. So the cephalic vein is on the lateral aspect, the basalic vein is on the medial aspect. Both are collects the venous blood from the part of the hand, forearm, and some part of the arm region also. So here the major on the medial aspect, the basalic vein, that deeply enters the half of the middle of the arm region. Then it's continue upwards from the lower border of the teres major muscle. It will be continued as an axillary vein up to the outer border of the first rib. That is the main point and locations of the axillary vein. So usually it starts at the lower border of the teres major muscles, be remembered. Then almost this vein is lies on the medial side of the axillary artery. The axillary artery is lateral side and the medial side there is a axillary vein. So these are the two major blood vessels in the axilla region, that is axillary artery, axillary vein. Then comes to the structures lying in between the veins and artery. What are that? Particularly in between the artery and veins, there are the some of the important nerve fibers. What are that nerve fibers in between these two vessels? Mainly medial pectoral nerve, medial cutaneous nerve of the forearm, and also the medial cord of the brachial plexus and ulnar nerve. So these are the some important nerves which will be mainly supplies to the pectoral region, that is the medial pectoral nerve, then medial cutaneous nerve of the forearm, that is supplies to the forearm region, cutaneous portions, then medial cord of the brachial plexus, that is gives the branches, major is the ulnar nerve. So that will be the portion slice in between the artery and vein. Then again, the sheath, particularly, which will be enclosed with the artery and vein. So that is usually called as axillary sheath. That is the point you have to be remember in related to this of the portions in relating vein. Then what are the tributaries? Just you follow the branches of the arteries, the same name, the same tributaries. Why you are going to make a tributaries here? Because the small veins, the tributaries unite to make a major veins, that is opposite to the arterial system. So that is why we are saying the tributaries of the veins and branches of the arteries, like that you have to use the terms. Yes, next please. So then another important is the brachial plexus. That is the sum of the important nerves. What are that here? As I already told, the brachial plexus is one of the important plexus. It is network of anterior rami of spinal nerves, particularly C5, C6, C7, C8, and T1. What do you mean by C5? That is cervical spinal nerve, fifth, cervical spinal nerve, sixth, cervical spinal nerve, seventh, cervical spinal nerve, eighth, and thoracic spinal nerve, 1. So these spinal nerves, particularly anterior rami, they are unites and forms a network, interconnections, and interjoining. Almost it will be a network arrangement. So that network arrangement is usually called as brachial plexus. And another important you have to be remember, this brachial plexus is mainly supplies to the upper limbs and some part of the shoulder and some part of the neck region, and major portion is almost the limbs, upper limbs, arm region, forearm region, whole of the upper limb is particularly the major roots and major nerves, particularly from the brachial plexus in associated with the other region also. So this brachial plexus, some partial portion is in the neck region and some partial portion is in the axilla region. So the 50%, the beginning portion is in the cervical region and the terminal portion is in the axilla region. So here we have to concentrate to the axillary part. I am not going to be concerned with the neck region, but anyhow, briefly I will be like to explain you. So usually the brachial plexus has the following parts like a root, trunk, divisions, and cords at the different levels. As in generally, the step or the stages in a different levels, root level, trunk level, divisions level, and cords level. That is the arrangement of this network of the nerve fibers as in these headings. So in root level, trunk level, divisions level, and cords level at the different points you have to be make it any identifications. In the axilla region, there will be some portions and neck region is in some portions. For example, root and trunk. That region is particularly in the cervical region. Cervical means in the neck region. So usually the divisions are lies under the clavicle bone. So this root and trunks usually under the clavicular bone. Then particularly the cords and nerve branches which will be lies in the axillary region. How many cords? There will be usually the three cords: medial cord, lateral cord, and posterior cord. These three major cords which will be formed by the divisions, detail is different. Just to be understood in the axilla region, the cords means the three important cords: the medial cord, lateral cord, and posterior cord, and its branches are almost lies in the axillary region. And simple answer is why should be called as a medial cord, why lateral cord, why posterior. We understand relation with the axillary artery. The nerve which will be related to the axillary artery medial side, medial cord, lateral side, lateral cord, posterior to the artery, posterior cord. Simple understanding of these three cords, position and relations. Yes, next please. Next please. Yes. So now we'll come to the axillary region. As I told, the three cords, as the medial cord lies medial to the artery and posterior cord lies posterior to the artery, lateral cord lies lateral to the artery. Which artery? Axillary artery. Simple. So the cords, three in numbers. The anterior is artery, just medial to the one nerve, that is medial cord, lateral to the artery, that is lateral cord, and posterior to the artery is posterior cord. Just you have to be three important cords in related to the axillary artery in the axillary region. Then what are the important nerves here? The important nerves in this axillary region, they are the main nerves and important nerves, and these are the branches of the cords. Or as particularly one important is the median nerve. That median nerve is particularly formed by the medial and lateral cords, runs anterior to the axillary artery. Then the ulnar nerve, that is on the medial side from the medial cord, and then again the radial nerve, that is from the posterior lateral aspect from the posterior cord. In the axilla region, don't forget these three: ulnar nerve, radial nerve, and axillary nerve, and the particularly median nerve. So these are very important in related to the axillary region. The median nerve is formed by the both cords, that is lateral and medial cords. The ulnar nerve is branch from the medial cord. Then axillary nerve and radial nerve posterior lateral aspect, that is from the posterior cord. So you forget everything, but remember axillary nerve. Why? Because it is mainly in related to the axillary region. The axillary nerve is in the axilla region. It is very important in that of the region, that is axillary nerve. Rest of the other nerve passes through the region of axilla. Even if you forget it, nothing to worry. Suppose if you wanted to region the any clinical point of the axilla, but be remember axillary nerve, don't forget it. And along with these three nerves, this one, three, four nerves, there is some muscular branches. They are supplies to the muscles of that of the region. Yes, next please. So just I will be highlighting the axillary nerve, not other nerves. Just I will be highlighting the some most of the important the axillary nerve. So this axillary nerve is a branch of posterior cord. It is lies posterior to the axillary artery. So and this nerve is lies lateral to the radial nerve. So this nerve is branch from the posterior cord, that is arises from the posterior aspect. Then it is almost lies posterior to the axillary artery, and this nerve is lateral to the radial nerve. Why? Be understood, it will be almost runs and distributed in the axillary region by giving an branches. So usually that axillary nerve is leaves the axilla. How? By passing through the quadrangular space along with the posterior circumflex humeral artery. So this nerve which will be runs, so that is the any particular portions of the circumflex humeral artery along with, then there it divides into a anterior and posterior divisions. So anterior division is runs along with the posterior circumflex of the humeral artery and encircling the surgical neck of the humerus, and supplies the most of the deltoid muscle and teres minor muscles, and also to the shoulder joint, skin over that deltoid, and also some part of the portion of the arm region. So that is the portions you have to be remember. That is the point in related to the axillary nerve. Yes, next please. Next slide. So median nerve, I'm not going to the details. It is formed by the union of medial and lateral cord that runs anterior to the axillary nerve, axillary artery, and it is mainly give the branches to the arm, forearm, and hand regions. Then ulnar nerve, it is a branch of medial cord that runs between the axillary artery and axillary vein. So this artery is being lateral to the vein, being medial. It is also mainly runs downwards and runs along with and towards the part of the ulnar bone side. Then radial nerve, the radial nerve is on the lateral aspect. It is also a branch of posterior cord that lies posterior to the axillary artery. It is runs posterior lateral aspect, and it runs and gives the branches to the forearm region and also to the hand portion. So these three nerves, main nerves, passes through the axilla region, but their contribution is mainly in the upper limb, arm, forearm, and in the hand regions. Dear students, be remember the three nerves which are very important in related to the humerus. How? The axillary nerve is related to the upper part of the humerus, the radial nerve related to the middle part of the humerus, the ulnar nerve related to the lower part of the humerus. So all these three nerves, especially axillary, ulnar, and humerus, so that will be the portion of three nerves. Any fracture of the humerus, upper part, axillary nerve damage, middle part, radial nerve damage, lower part, ulnar nerve damage. So these three nerves are very important in related to the humerus, but we are giving the concentration to the axilla region. So the axillary nerve is very important in related to the axilla region. So any fracture in related to the upper part of the humerus, for example, the surgical neck, the common site of the fracture is surgical neck. Why it's given as a surgical neck? Because any fracture up in this region, surgeon has to concentrate properly what are the structure in related to the surgical neck. He concentrate axillary nerve, anterior and posterior circumflex humeral arteries, main concentration, and then according to that he has to go for treatment. So that is the point you have to be related clinical point. Yes, next please. Yeah, just you can see the picture. So here you can see this red curved structure is the artery. In related to this artery, you can see the lateral side. This is the lateral cord, and you can see in the medial side, the medial cord. This line portion is on the posterior cord, posterior to the artery, medial to the artery, medial cord, lateral to the artery, lateral cord, and posterior to the artery, posterior cord. This is in the axilla region. So this is cord level of the brachial plexus. You can see the median nerve. This is the median nerve, which is formed by the union of lateral root part and as well as medial root part unite to form such a median nerve, important nerve in the median portions. Then again you can see there is the ulnar nerve, that is from the medial cord. You can see this is the medial cord, this ulnar nerve that is on the medial side, medial to the artery. Then the radial nerve that is on the posterior aspect from the posterior cord. This is the radial nerve. Just it is a relation in the axilla region with the axillary artery with the pectoralis minor muscle. So why clinical importance? If you know this anatomical relations, definitely you can understand the clinical point of view when the patient is comes with your related symptoms or a signs or whatever is identical point. This is the picture of the brachial plexus, but we are concentrated in the axilla region cord level. You can see C5, C6, C7, C8 and T1. This is the spinal roots of that is a particular C5, cervical 5th, cervical 6th, cervical 7th, cervical 8th, thoracic 1. These are the spinal nerve roots, and particularly ventral rami only take the brachial plexus, not the posterior rami. This is the anatomical picture of axillary region in related to the nerves. Yes, next please. Then we'll come to the clinical points. Is it a delay? No problem, no?
No, sir. No problem, sir.
Nothing, no?
Nothing, sir.
Yeah,
Nothing, sir.
just I will finish as earlier short. If it is
Okay, sir.
delay, you
Okay,
can
sir.
inform me. I will stop. Nothing to worry. Huh?
No, sir, you can continue, sir.
Okay. So now we'll come to the clinical points of axilla region. I will be highlighting some important portions of the clinical related applied anatomy. So I told you the axillary nerve relation. So this axillary nerve relation with the surgical neck of the humerus. Be remember, always danger during the fracture of the bone and dislocation of the shoulder. So dislocation of the shoulder and the fracture of the humerus at the surgical neck region. So definitely that causes the axillary nerve damage. So what will happen if the axillary nerve is damages? So that the damage to the axillary nerve leads to paralysis and atrophy of deltoid muscle. The main complication, the main symptom is the paralysis of deltoid muscle and simultaneously atrophy of the deltoid muscle. That is the one of the important clinical point of view. Be remember, if the deltoid muscle, sir, how I could be identified deltoid muscle is paralysis? Just ask to the patient to make your hand or your upper limb to make abduction or adduction. Adduction, abduction movement. Abduction is away from the medial plane. If he is unable to make abduction, then definitely you can be identify something will be wrong in the axillary nerve. Similarly, the teres minor muscles function. So the loss of the functions of the teres minor and deltoid muscles is very clinical significant symptoms in related to the axillary nerve damage. Then simultaneously there is a loss of sensation of skin, especially lower half of the deltoid region, that is the lower half of the deltoid. Usually the sensation is lost because the branch of that nerve is supplying to that particular area. So be remember of these three important points. What are that? Number one, the deltoid muscle, teres minor muscle, and the loss of sensation, lower half of the deltoid region. That three significant features will be indicates the damages of the axillary nerve. Then suppose if the brachial plexus may injured in trauma caused by traction, stab injuries, or compression during the surgical procedures. So during the traction, usually what happens in the shoulder joint dislocations will go for the tractions. So at the time, if you have the mishandling, so if it is not properly go for the traction, so there may be injury to the brachial plexus also. And also stab injuries. And there is also in a compressions during the surgical procedures if it do. So that may leads to the some of the complications and the problems and the clinical symptoms in related to the axillary nerve, particularly up in this shoulder region. Yes, next please. Next slide. Yeah. Then again, in related to the artery. So this axillary artery, especially the main artery and its branches particularly related with the head of the humerus, neck of the humerus, and shoulder joint. The three parts, the head region, the head of the humerus, neck of the humerus, and shoulder region of the upper limb. So that is the three important regions which should be mainly in related to the axillary artery and its branches. So usually the vessels likely get ruptured. That vessels may be damaged during the reduction of old dislocation of the shoulder joint. So due at the time of the reduction of the shoulder joint reduction time, you may damage the axillary artery that may leads to these things. Then another one is thrombosis. The thrombosis of the artery may cause the obstruction of the blood flow that leading to the ischemia and that may cause to the death of the particular tissue. It is nothing but gangrene. So the thrombosis may causes the obstruction of the blood flow. Due to the obstruction of the blood flow, there may be any ischemia. Due to that ischemia, the particular region of the tissues is becomes death. It is nothing but gangrene, that particular part of the portion. Then similarly, the two important branches of that, the anterior and posterior circumflex humeral arteries. They are the branches from the third part of the artery, that is anterior and posterior circumflex humeral arteries. So these arteries usually damages in case of fracture, usually at the surgical neck of the humerus. So if the fracture is in the surgical neck, so be remember the anterior and posterior circumflex humeral arteries and axillary nerve. So three important structures which will be go for the damages and may causes the clinical signs and symptoms. Why? Because anterior and posterior circumflex is circums the surgical neck, and along with that the axillary nerve is related to the surgical neck. So this is the clinical point of view. Be remember in the region of axilla point of view. Yes, next please. So this is the clinical point of view, and I try to explain in related to the point of axilla and its clinical point of view in a brief manner. I'm not entered to the much more depth, and that is the point you have to be remembered. Then what is this knowledge? So one of the scientists has explained that, see, education is what remains after one has forgotten what he has learnt in the school. That is the one of the important remembering point you have to be remembered. What is the education? The education is what remains after one has forgotten what he has learned in the school. So once we are forgotten what we are learning in the school, that means once we are entered in the field, so we will get the experience, knowledge of that of our experience, and makes that perfect knowledge of our education. So that is the one point you have to be remembered in related to the one of the micro scientist Ines Pin has told of this quotation. So always I am thinking and believing of these quotations, and this is about the today's point in related to the auxiliary part. Yes, next slide. So just I will show you. See, this is the how it will be compression is happens. See here, this is the clavicle. So just in between the clavicle and first rib. So this artery passes the subclavian artery continuation along with this nerves. So here the compression between this clavicle and first rib compression may leads to the symptoms. Similarly, this particularly the tendon of pectoralis minor that may squeeze or stress. How? If you done the more abduction, if you are go strongly abduction, definitely the pectoralis minor tendon, which will make the suppression of this axillary artery and as well as this nerves. This is the just a clinical point of view picture in these two region. One is in between the clavicle and first rib, and just deeper to the pectoralis minor tendon, not muscular portion, tendon, especially at the insertion part of the muscle in the coracoid process. That will be the region of the things. Next, please. Next slide. Yes, next. So be remember, this is the point which I have be remember. So this will be just an examples which I have given how the cords of the brachial plexus and the subclavian artery can be squeezed between the clavicle and the first rib in some individuals, and how the axillary artery and the branches of the brachial plexus might be pressed upon by the pectoralis minor tendon when the arm is abducted at the shoulder joint. Please remember this the 2 points. Okay, next please. So this is the just relation of the posterior aspect of the axilla region. Along with this, you see this is a radial nerve in the posterior aspect. Usually that will be runs in the posterior lateral aspect of the humerus. That will be posterior cord for the just for showing purpose that I have shown here. And here you can see this axillary nerve. See that enters this portion of quadrangular space, and it will be encircles this surgical neck. This is the axillary nerve. This axillary nerve and this radial nerve is branches from the posterior cord, and this particularly in the axilla region, this axillary nerve is enters and circumflex, which will be in the neck region of the humerus, and that is the important. Radial nerve is going down. This is just for the identical purpose, and this is the slide. You can identifications of that muscles, the subscapularis muscles, teres major muscle, latissimus dorsi muscle, that will be the portions of then triceps like that. This is the point in related to the things. Okay, thank you. Yes, next. Next slide, please. So thank you to the one and all. So thanks to the organizers, thanks to the faculty members, thanks to the principal of the Kottakkal Ayurvedic College. I am very grateful and very my great pleasure to share my knowledge with all of you. Any questions, anything is your clarifications, most welcome. I will clarify as much as possible. Okay, madam.
Okay, thank you, sir. Thank you,
Thank
sir,
you.
for the very informative session. All the anatomical and clinical points were explained in a simple and easily understandable way. And
Yeah.
once again, I thank you for accepting your invitation and for this excellent class.
Yeah. Any questions? Anything?
Participants, please raise your queries.
In the chat, there are some
Sir,
questions.
Yes,
we
sir.
have some questions.
Yeah, some questions in the chat.
Sir,
One is
is there any disease related to axillary artery?
yeah. Sir, is there any disease related to the axillary artery? So one is that damage that is leads to the bleeding. If it is a fracture in the surgical neck region of the humerus, so what will happen? There is a damage of axillary artery, especially the branches, that is anterior and posterior circumflex humeral arteries, that may lead to the bleeding, the hematoma in that of the region. The patient may get the severe pain, hematoma, and the loss of the movements, or even a small movement, maybe painful movement. Everything will be happens up in this damages of the axillary artery. Then another thing is, if it is damage in the first level itself, so there is a severe bleeding. Because of that, it is the main artery to supplying the whole upper limb. So anything is damaged in the axillary artery in the beginning itself, so most of the whole, the upper limb is becomes as the tissues becomes as death. That means no blood supply. Almost there is a bleeding in that of the particular region. There will be a hematoma is forms and severe things will be happens. And another important, you have to concentrate branches. That is particularly anterior and posterior circumflex humeral artery. I hope this is the answer for. I think you are satisfied. If not, please make it questions, or you can just, I will give the much more explanations about the things. Then second question is, what are the major defects of axillary region leading to the paralysis? So here we remember the paralysis, as I told, the two important muscles. One is the deltoid muscle and another one is teres minor muscles. So these two muscles are damaged. That means innervation by the important axillary nerve. So if this axillary nerve is damaged by the trauma, by the fracture, by the dislocation, or by of any surgical procedures doing with the mistakes, or in reduction of the shoulder joint and all those things conditions, definitely there will be a paralysis of the deltoid muscle and also teres minor muscles. What it may be happens, just best example, you can ask to the patient, raise your hand or do abduction, or you can go away from the median plane. If the patient is unable to go for that moment, so he is having a pain and something, then automatically it will be clear indication of that the nerve has damaged. There will be injury to the axillary nerve. Even sometimes the patient is comes with the shoulder pain. Simple, the shoulder, sir, I have a pain just in the lower part of the deltoid. I am pain while moving into the outside or in the abduction time and something like that. So there is something will be compression by the muscles or compression by the some any other substances may cause the this problems is, that is usually paralysis in related to the this nerve and as well as these two muscles. That is the one of the important portion. That's why I told you. So that is particularly thoraco that acromial, that particular one nerve which is passes through the floor of the axilla, that will also leads to the paralysis conditions. That is the one of the point. Then what are the treatment aspect related to the defects of axillary region? So the treatment is based on actually depend upon the injury and depend upon the causes of injury. According to that, we have to go for the treatment. So we have to find out what is the region, what is the happens. According to that, we have to the treatment plan of line treatment. You can give Ayurvedic treatment, modern treatment, any treatment, but according to the situations, according to the conditions, and according to the part of the trauma, and according to part of the symptoms, as according to that, we have to go for the treatment, then that will definitely helps there. Just I will tell you, for example, the sum, it is one of the best examples. I am not going to repetition. See the joint, usually already known that the joint is usually particularly synovial joint, which are movable joint freely, especially shoulder joint or some of this elbow, wrist, something, whatever you can take synovial joint. So this synovial joint is covered by the synovial membrane. According to that Ayurvedic concept, it is said that Slash Madara Kala. So this synovial membrane, which lining the fibrous capsule internally, and simultaneously there is a fluid. That synovial fluid is inside the joint cavity. That fluid is makes helps the lubrication. That is avoiding the friction during the movement of the joint region. So here sometimes there may be a some of the small pathological condition, synovial cyst. The synovial cyst means the cyst particularly formed by the synovial membrane. It is not any much more complicated and other things, but it's a simple, but the cyst is develops by the synovial membrane. This synovial cyst cannot be identified by X-ray, cannot be identified of your any of the media of the something of your investigations, but only we can identify it by the CT scan. There will be possibilities. So such a synovial cyst, simple, may compresses the sum of the structures at the local structures. If that synovial cyst is compresses the particular of that of the structures, that may leads, that may causes the temporary symptoms. That will be a cause of local defect, and according to that we have to go for the treatment. Just I will give you this example in related to the Ayurvedic related treatment in the axillary region. So just I will give an example how it will be the things. So that is mainly one of the from my student Mrs. She had very difficult to even hold a pen or a pencil by the thumb, index, and middle finger. It is very difficult. Even a small pen she cannot hold, she cannot write, she cannot lift anything. So very hard, severe pain. Nothing to be of the any other things. She is taking a analgesic drugs since 3 4 months. No, once taken medicine temporary, then again the same thing is there. They have taken X-ray, everything, wrist joint, nothing else. Then finally they come with me, sir, this is the happens, what we have to do. Then I thought that what are the anatomical structures? So just I thought that, okay, what are the finger? Thumb, index, and middle finger. What is the deformity? Flexion deformity, not possible to hold. Then I thought that immediately what may be the region. So something will be a defect in the radial nerve. So what defect? The something, the radial nerve is compressing. Where it is compressing, that you have to find out. So my knowledge is immediately goes that, so the radial nerve is compressing. So due to that compression of the radial nerve, she is unable to hold any a small part of the portions of the objects or a subject. Then I thought that immediately I went to the CT scan object. So then I found out that there is a synovial cyst in the wrist joint, especially on the dorsal aspect. The same thing is happens in one patient up in our my local Manipal, that is in the axillary region, that is particularly the synovial cyst in the shoulder joint. So these are the one of the example that will be the makes of the symptoms. Then what is the treatment? In modern concept, surgery. No medicines for this synovial cyst. Once you go for the modern concept, they will advise surgical point. Then I advise to make a pressure by gradual putting the pressure on that of the particular lesion. So gradually within 10 to 15 days, the synovial cyst is almost, it will be suppressed and becomes as a normal. Almost every symptoms will be clear just by pressure. That we can take it as a marma chikitsa, or we can take it as a acupressure, or you can take it whatever it is. That just simple is pressure. Just I thought that marma chikitsa. I went to the marma chikitsa, particularly identificate of that marma sthana and particular of that region of the radial nerve, just compressions of that particular axillary nerve and radial nerve. I got the result 15 to 20 days by putting the pressure and treatment, simple oil applications, not much more massage and nothing. So that is helps to the development. This is an Ayurvedic treatment in related to the part of the portions. Definitely there is helps. I hope you are clear about by this point. Yes. So here there is one question. The root, trunk, divisions, etc. What is the difference? Why parts of brachial plexus are given different names? Yeah. So answer for this question. This is actually the parts of the brachial plexus. How it will be forms, all that formation and part of the portions is called as in a different level. Simple, I will explain you. As you already know, spinal narrow roots C5, C6, C7, C8, T1. 5 spinal nerve roots, anterior rami. Anterior rami of these 5 spinal nerve roots 1, 2, 3, 4, 5. You can go for above downwards. Above C5, next 6, 7, 8, and T1. So what will happen? C5, C6 unites, becomes as in a one part, and C7 remains one separate, and C8 T1 unites 1 3. So what this one? These three portions, C5 C6 unites one part, and C7 remains one separate, and C8 and T1 unites, that becomes separate. C5 C6 unites, it becomes as a upper trunk. The C7 remains as a middle trunk, and C8 and T1 unites, that forms as a lower trunk. This is trunk level. First root level, then trunk level. Upper trunk, middle trunk, lower trunk. Upper trunk formed by the C5, C6, middle trunk by C7, lower trunk by C8 and T1. Then these three trunks divide the each two. That is upper trunk divide the two divisions. One is called anterior division, another one is called posterior division. Same, the middle trunk divides anterior division, posterior division. Then lower trunk divide anterior division, posterior division. Each trunk divides two divisions. One is becomes anterior and another one is becomes posterior. This is division level. Are you clear? So root level, trunk level, division level. Now the division level, what happens? Upper trunk 2 division, middle trunk 2 division, lower trunk 2 divisions. In 2 divisions, one anterior, one posterior, one anterior, one posterior, one anterior and one posterior. Now here in cord level, what happens in the cord level? So the anterior division of upper trunk and anterior division of middle trunk unite to form as a one card. That is the one point. Then the lower trunk, the anterior division is remains one part. So that is one card. So then the posterior divisions of all the three trunks, that is to becomes as the part of posterior cord. Just you can go for the slide in previous. Just I will show you the picture so you can make it identification. Just go to the slide. Is it possible? So yes, simple. That will be the, just go behind. Next, previous slide. Previous. Yes. See here. This C5, C6, C7, 8 is root level. T1 is root level. See this C5, C6 unite to form as a upper trunk. C7 remains as a middle trunk. C8 and T1 is unite to form as a lower trunk. So these are the three trunks level: upper, middle, lower trunk. Then again, these three trunks divide the divisions. See, upper trunk gives division 1, that is anterior division. Middle trunk gives one division, that is anterior. And lower trunk gives the division anterior. So these three anterior. And similarly, three posterior. That means each trunk gives two divisions, one anterior, one posterior. So anterior division of upper and anterior division of middle, they unite, forms as a one cord, is lateral cord. Have clear? Then the lower trunk anterior division is remain separate, that becomes as a medial cord. All the three posterior divisions unite, becomes as posterior cord. So just you can go through this picture, this slide, it will makes a very clear picture of about your brachial plexus, root level, trunk level, divisions level, and cord level, and branches level. I have not shown all the branches, just I have shown the branches of in the axillary region. I hope that you are very clear about by this doing up this picture. Okay. I think you are clear about the portions. Is it okay, madam? Any questions?
Sir, one more question.
Yes.
What is the significance of dividing axillary artery into three segments by pectoralis minor?
Yeah. Okay. So here the question is there is no any significant. Then what it is? There is a course of vessels. That is an anatomical relations and anatomical part of the portion. That's all right. This is not any significant because the course of the vessels, the attachment of the muscles is actually that is a part of anatomy. We cannot make it answer, sir, why it is like that? Why not the muscle is go back? Why not will be comes to the left side? So there is no answer for the this in the anatomy. So we have to study the anatomy, what it is, how it is, and try to make it identifications. There is no any particular segment or particular significant in that of the positions. We don't have any answers, but we have to study the course. The artery is runs behind the minor muscle. Due to that, the artery is divided into three parts. This is just for anatomical explanation purpose, not any other purpose. I have to make it a clear understanding of the artery and its three parts and three branches from that of the particular portions. So just it will be a course of that particular locations of the structure. There is no any significant. The significant is there, but for that, why, how, when? So there is no answer in the anatomy. So we may have in a question, sir, why we have only 5 fingers? Why not 6? Sir, we have a 2 eyes. If one eye is in the posterior, it will be better. I can look on the anterior and as well posterior like that. So, but no answer for that because it is a development of the embryo. It is a development of the human body that you have to study how it is and all those things. I couldn't make it up that it is any significant or it may be any related, nothing to be for that. But the anatomy is how, what is, where it is. You have to get the knowledge and depend upon that knowledge. We have to be concentrate the portions. This is the answer for that. I hope you are clear by my answer. Yes.
Yes, sir. Thank you, dedicated and eminent teacher of anatomy with more than 40 years of teaching experience. even though at the age of 70 years, sir is very enthusiastic to teach anatomy. With pleasure, sir accepted our invitation to present the topic. Thank you, my teacher, for accepting our invitation. For our students, you have shared knowledge regarding structural anatomy and clinical anatomy of axilla in detail, along with your clinical experience. And uh, thank you, sir, for sharing your valuable time with us and also clearing the doubts. It's my privilege to express gratitude to the today's speaker on behalf of Vpsv Ayurveda College and Department of Rachana Sharira. Thank you all the participants, students of various Ayurveda colleges and various faculties of different Ayurveda colleges for joining with us. By this, we come to the end of fourth session of Prayog Rachana 2021. The next session will be on 15th of July. Thank you all.
Okay, finally, I very much thankful to the management and principal and faculty members and our Rachana department faculty members. Most of Rachana faculty members are almost my students. It is my privilege, along with my students, I share my knowledge. I may not to the any of the things. It will be my new experience, along with my students, new students, upcoming students, everyone. So very much thankful to all of you. Any questions, any doubts, whatever is there, you be most welcome at any time. I given my email ID and as well as the cell number. So at any time you are most welcome to the our questions or answers or any of the transmissions to the post of the portions. So very much thankful to organizers, once again principal, faculty members and of our Rachana faculties and everyone. And it is my privilege you are identified and given me an opportunity to share my knowledge and experience, because the most of the anatomy and most of the clinical experiences is only by repetition of our practical expose, not by reading the anatomy. One of the example which I have uh, got by one of our faculties and observed there, sir, you are giving the PPT. If the same PPT I taken, I copied, but I presentation I cannot do like you. That is the difference between you and me. I can take and but I cannot do. So this is the fact. Okay. Thank you to one and all. Thank you for this. Good
Thank you,
night.
sir.
Thank you, sir. Thank you, sir.
Thank you, madam.
Yes, sir.
Thank you.
Thank you, sir.
Thank you, Dr. Bindu. Thank you, Dr.
Yes.
Shaini and Dr. Amal. Everyone's will be very much thankful to all of you. Okay. How was the response? Is fine?
Yes, sir. Yes, sir.
Okay. 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 We may conclude.
Okay, bye, sir.
Okay. Thank you. Thank you. Bye. Thank you.